Rai Chandan Pillai, usually called as Dr. Jai. He has got a 25 years experience in the pharmaceutical field, especially in hospital pharmacy, clinical pharmacy, community pharmacy, coding, teaching. Currently, he is specialized in clinical pharmacy practice as a teacher, community community hospital for drug therapy optimization, pharmacokinetics dosaging, monitoring of antibiotic and therapy and its medication with narration of narrow therapy, therapeutic induce, total parental nutrition and chemotherapy. He has done his education in India with a B Pharma from Madurai Medical College, Madurai, and he is the first rank holder in 1976. He has done his pharmacy MS in pharmaceutics from Long Island University, New York. He has completed his PharmD from the College of Pharmacy, US in 12, and he has got a vast experience in pharmaceutical lecture in pharmacy as a lecturer. He worked in KMC University, Manipal between 76 and 80. Pharmacy manager in NMC Hospital, Abu Dhabi. Graduate teaching associate in New York. Holy pharmacist in Holy Cross Hospital, Maryland. Pharmacy supervisor in Florida. Opera consulting pharmacist in Noida. Clinical pharmacist in Los Angeles, in Noida. Clinical pharmacist in Dignity Health, Noida. Worked from 2005 to 2021. He has got a vast experience in teaching experience with teaching and training PharmD students in advanced clinical practice. Teach medical college students on neonatal drug therapy, counseling, and educating patients on discharge, medication, and anticoagulation therapy. His professional affiliations: he is a member of Ryochi Society, Brooklyn, New York, member of American College of Clinical Pharmacy, member of American College of Hospital Pharmacy. With this, he has got many certifications like BCP, BCPS, Board of Certified Pharmacotherapy Specialist, ACLS, Advanced Cardiac Life Support, BLS as Basic Life Support, ACCP, attended teaching and learning course. He has presented several papers, published several publications in, in national journals. With a few introduction, I welcome Dr. Jai today to the webinar on the topic of clinical review of physician prescription prior to dispensing for drugstores.
Thank you so much again for the introduction from the State Pharmacy Council. In part, we discussed about a brief introduction of the clinical pharmacy practice in the US and some of the things that we can emulate from those practice points and apply to India. That'll be helpful. In part two, we will get into the actual prescription, the actual practice, live practice of clinical pharmacy in a drugstore setting. What we're going to do here is to give an example of a prescription that comes to your drugstore and how you would review based on what we learned in the previous part one and apply those principles so that the right medication is dispensed to the right patient to get the best benefit out of the treatment process. Let's get into that. The webinar objectives of the part two is to discuss very briefly types of medication errors, and we will focus on particularly prescribing errors because the prescription comes to you, there might be some prescribing errors, and we got to catch it before it falls through the crack. And there are some guidelines that I will give you. They are not, rules, but they are recommended guidelines how to review a prescription. And I'm going to discuss very briefly the pathophysiology of urinary tract infection as an example. And the prescription that comes to the outpatient community drugstore is a prescription drug that contains an antibiotic that treats UTI. And then when the patient goes to the hospital with a similar UTI infection, how it is handled, that'll be discussed in part three. And I will discuss some of the communication skills that we have to practice and develop before we speak to the physicians. And finally, I believe there may be some questions and answer sessions, and I will be able to answer them either through directly or through different format. And let's go to the next slide. The type of medication errors, there are 4 different types of medication errors. One is prescribing errors, which are about 46.5%. See, it is the largest errors that comes across through prescriptions. So if you stop those 46%, that'll be wonderful. And the dispensing errors are about only 14%. And the transcribing errors, which means when the doctors communicate the prescription to the nurses in the hospital or someone else in the hospital, when they transcribe what the doctor told that person, the error occurs is up to 10.5%. And there are some administration errors, again, in the hospital setup, 29%. And in this example, we are going to focus on the prescribing error that comes in the prescription that you're going to receive in a retail drugstore. How to review an RX? First of all, we have to identify the indication for the drug. When the prescription comes to the drugstore, we should be able to identify, is there an indication for this drug? Is there a use for this drug? And also if the medication prescribed is appropriate for the indication that you identify. Is the dosage correct? Also, are the directions correct for the particular medication? Are there any clinically significant drug-drug interaction? Are there any clinically significant drug-disease interactions? Is there a necessary duplication with other drugs? If the patient is taking a medication, they may go to a different doctor and a prescription for a different medication for the same indication. There should not be a duplication. For example, taking 2 beta blockers or 2 calcium channel blockers. They are duplications. Is the duration of the therapy is acceptable? If it is an antibiotic, if it is given for a certain duration, 5 days, 7 days, or 10 days. Is this drug the least expensive alternative as well? These are some of the guidelines that you might want to follow when we review a prescription before dispensing. like we said, I'm going to review the pathogenesis of the urinary tract infection because the prescription that comes to you is for a urinary tract infection. UTI is the abbreviation, as we know. And what is the pathogenesis? The UTI involves kidney, ureter, bladder, and urethra. Urinary tract is normally sterile, and urinary tract has a defense mechanism built in. How does it defend against infection? One, by complete emptying. Urine also has acidity that prevents infection, that kills infection. And also there are some valves, vesico-urethral valve built in that allows the urine to flow one direction and does not let the urine to ascend up the ureter. So the one flow of the urine also help empty the urinary bladder completely. And also there are some immunologic and mucosal barriers built into the urinary tract that kills most of the infections. And 95% of the UTI occurs due to the ascension, due to the bacteria going up into the urinary tract from the bladder. And the infection comes from urethra, especially in female population, right? The bacteria, which is mostly E. coli, right? E. coli comes from the rectal area. From the rectal area, it gains entry into the urethra, and the E. coli multiplies here, and then it starts ascending through the ureter into the kidney. As long as the E. coli is confined to the lower part of the urinary tract system, it's called as uncomplicated UTI. There is no complication as long as the bacteria is confined to the lower part of the urinary tract. Once it ascends through the ureter and goes into the kidney is infected. At that cage, it could be called as a pyelonephritis or acute kidney injury. In this case, the upper part of the infection is called complicated urinary tract infections. And we are going to focus on uncomplicated urinary tract and the treatment for that. So for the purpose of discussion today, it'll be an uncomplicated urinary tract infection that is confined to the lower part of the urinary tract. Here is the prescription. Dr. Shivananda Clinic comes into your drugstore. He's a wonderful doctor. He is also an infectious disease specialist. And the lady, Sunshine, goes to Dr. Shivananda and then complain of lower abdominal pain. And the final diagnosis by the doctor based on the symptom description is uncomplicated urinary tract. Dr. Shivananda wrote the prescription for this lady, amoxicillin 500 milligram every 6 hours with no refills. And also, on top of that, he prescribed a birth control pill, low estrogen once a day with 11 refills on it, because she is only 28 years old, married, and she doesn't want to get pregnant. When I'm looking at this prescription, immediately I recognize that the Dr. Shivananda has prescribed the right antibiotic, although the duration or the schedule that he prescribed is every 6 hours. And the second issue is that I'm able to identify a drug interaction between amoxicillin and the birth control pill. If you give these two medications at the same time, what happens? The amoxicillin can impact the efficacy of the birth control pill, which means the low estrogen is not going to be effective in terms of its birth control. The lady might get pregnant. So those two are the immediate identification of the issue with this prescription. And let's discuss about the prescription as well. The prescription, there are different parts. The top part is the physician name, address, DEA number, and the date. And the second part is the patient's name and address. And the third part is the superscription, which contains the RX information. And the fourth part is the medication's name, strength, directions, and the quantity. It's called as inscription and subscription. And finally, you got the doctor's name and address and the signature. These are the different part of the prescriptions in general that we should be able to have a clear prescription delineating these different parts. And let's look at this. Some of the points that we discussed, we are supposed to look for an indication, right? By talking to the patients, I happen to be in the drugstore. I receive the prescription, and I'm just inquiring as to what is the drug prescribed for by talking to the patient. I am asking Sunshine, it appears, do you have some problem with the infection or something? Then the lady says, yes, I got some, urination difficulty, burning sensation. And that gives me a clue that she had the urinary tract infection. And I identify that amoxicillin is appropriate for that indication. There is an indication, which is UTI, and the effectiveness of the medication, amoxicillin, is very good. And the dosage, I'm looking at it, the dosage is 500 milligram every 6 hours. Amoxicillin is actually given 500 milligram every 8 hours, not every 6 hours, that one thing. And the direction needs to be, modified. And is there a drug-drug interaction? Of course, there is one with the lowest strength. And is there any duplications? I'm not seeing any duplications. Is there a duration of the antibiotic? No, the duration is not there. So is there a cost-effective prescriptions? Yes, it is. Amoxicillin is pretty less expensive, and it complies with this last part of the guidelines. So when we dispense this prescription, before that, I got to call Dr. Shivananda and explain, hello, Dr. Shivananda, I got the amoxicillin prescription, which is normally prescribed every 8 hours, sir. And also the duration for uncomplicated urinary tract infection is only 3 days. Would you mind if I make those changes in the prescription? And because we know each other, very well for quite some time, and we share information, Dr. Shivananda immediately agrees. Yeah, please go and make those changes. I appreciate your calling and your recommendations. And also, I kind of informed him that I'm going to counsel the patient as to how to take the birth control pill because it can be impacted by the antibiotic, making the birth control pill less effective. And he appreciates that as well. And the final prescription, which is optimized prior to dispensing, is amoxicillin 500 milligram every 8 hours. Usually it is given for 3 days, but we put it as 5 days, 3 to 5 days is good enough. And I tell the patient that there is a potential drug interaction between these two. So I would recommend Sunshine that she either stay away from any romantic interlude when she's taking the antibiotic, or she has to use other forms of birth control options, such as using condoms, which is preferable. So we got to tell those points to make sure that she follows that in a way that she does not get pregnant, because that's her intention is. So that is the completely optimized prescription in a retail drugstore that comes to you. And that's how we practice in the US, which could be easily followed in the drugstore setting. And for the next one, I'm going to talk about a same, similar indication. A patient goes to the hospital, and how do we handle in the hospital? And I thank you very much for this.
Thank you, Dr. Jay Pelissar, for your excellent presentation on clinical review of physician prescription. Sir has explained in detail about the pharmacist's role or the checkpoints prior to dispensing a prescription to a patient. He explained very detailed about how to check a prescription and what are the checking points which you have to specify, like effectiveness, dosage, directions, clinical significance, drug-drug interaction, drug-lab interaction, any duplication, etc. He has given a detailed checking points which a pharmacist should be aware when he dispenses any medication or any prescription. Dr. J has also demonstrated a review of prescription of a patient with a history of hypertension, diabetes, hypercholesterolema, ventricular arrhythmia, osteoarthritis in detail. He also highlighted that how a pharmacist has to communicate with a doctor or a prescriber. So coming to the take-home points, every prescription order requires a clinical review. Dispense only when all safety criteria are met. Contact the prescriber to clarify any inconsistencies. When in case of any doubt, call for clarification to the doctor or to the hospital. Be professional, polite, informative, and concise with physician. Patient safety is our primary goal. So as a pharmacist community, help the public or the patients to achieve their medication review or medication therapy. For today's webinar, if you have any query, you can mail to us at kspconline@gmail.com. So your query related to today's webinar will be answered specifically, and we will be able to meet for the next webinar in the coming days. We will be continuously conducting webinars in a gap of 15 days. All the updates of the webinar is available in our website. Again, I am repeating, all the webinar updates are available in our KSPC website, which is www.kspcdic.com. And there is a scrolling which is running in the top of the website, where you will get the YouTube link, then the webinar link, etc. And all the updates related to the webinar will be available in our website. So in future, kindly refer to our website so that you will get the details of the same in our website. In case if you don't receive the SMS, if you don't receive the mail, or if you are not aware about our webinar, kindly visit our website. So all the links will be available there. I hope that you enjoyed the session today. Sorry for some technical challenges which we faced initially and made you to wait for a long time. And if you want to see the screen, you can see there. There is a scrolling which is happening in our website where we'll be sharing about the webinar link, etc. So kindly, you can just go through that. And thank you once again. Have a great day. Thank you.